Good point. John, thank you very, very much. We'll be going back to the White House shortly. Ahead of that, I want to go to Dr. Jon Baugh, what he makes of this, the emergency room physician. He's helped us out with a lot of these issues throughout, and we always appreciate that, Doctor. Testing is important.
Thank you.
Now, for a lot of governors, as you know, Doctor, they've been saying this is the kind of thing that we are going to need to ultimately continue this reopening phase. So how important really is it?
The testing, is that what you're asking about, how important that is?
Yes, indeed.
Yeah, that really is one of the key components in us opening up the economy, getting people back to work and getting people out of their homes. That ability to not only just test the initial and to be able to identify who has the disease currently, but also that antibody testing that we've been hearing so much about, and determine who's had the disease recently, and to be able to find out who's also had and recovered from the disease, so we can start measuring our herd immunity. Because we think about this, we all want this economy to be back open. We all want to return to some sort of normalcy. And that's one of the key components in being able to do that. So what we hear today should be able to help us.
A lot of these states are reopening or opening for the first time today, Doctor. I believe 13 that either are starting the process or continuing the process. So more than half the states in this country are along the way here. What do you think of what you've seen thus far?
Well, I think that is really sort of a mixed bag. And the reason why I say that is because we want that. I think about us as physicians. We're small business owners ourselves. We want to be able to get people back to work. We want to get people healthy. But we're also cognizant of the fact that there are going to be more diseases. People are going to get more sick with COVID-19 as we open the economy. We're going to see that, that's for sure. But we need to have a plan in place that is helpful for our country, and not just stagnating our economy and stagnating individuals. I know that we're seeing additional diseases. People worsen with their cancer, and people worsen with their heart disease, and people worsen with their diabetes, and not to mention the psychological issues that we're dealing with people being at home. And we know that we need to turn those things around, and we are going to see difficult times ahead, but I think we're going to see better times ahead too. I think we're going to see this up and down a little bit. We are going to see improvement. I'm very confident in our society and in the members of this great country.
Doctor, we're talking about, and John Roberts was, the promising testing going on in South Korea, yet even there we got word that in Seoul at least, new cases have popped up, unusually new and frequent cases that have popped up in the last 72 hours. We hear of record numbers that continue to be posted in places like Russia and India. How likely is something like that in this country?
I think it's probably pretty likely. And so we all look at the ability to do these regional openings and regional geographic closings or slowings as well. And so that's why we need to continue doing the testing so that we have an idea of it. And we need to kind of follow those recommendations of being able to have the ability to surge back into the hospitals. We need to be able to keep ICU beds open. We need to keep vents available. We need to be mindful of all those things as well, because it's very likely that we might see a resurgence or a reemergence of this disease, but we just need to be mindful of that. We need to go forward kind of with strength and faith, and realize that we can handle this and make decisions collectively for the good of individuals and for the community.
Doctor, earlier today I was speaking with a infectious disease specialist, and he was telling me that it's fairly likely now that for quite a while, a lot of Americans are going to have to get used to wearing gloves, in some areas, masks for some time to come. And that's just going to be part of our normal life and lifestyles, maybe for months to come, even as states reopen and even long after they have. Is that so, in your opinion?
Well, I think of it like this. I work in an emergency department. I see sick individuals. I have done so, obviously, for a decade. I don't get sick very often, and that's because I do the basic things that we're talking about doing now. I wash my hands a couple hundred times a shift. When I'm around sick individuals, I wear a mask. I wear gloves. Now, I wear a mask, I wear gloves, I wear goggles, I wear a face shield, I wear a coat or a robe. And so those things that we've learned through this process of increasing our hand washing and maybe a little bit of social distancing and at times some gloves and maybe a mask, I think that a lot of those are good habits for us to be able to carry forward no matter what happens. And will we need some of those for a little while to come? Probably. It's going to be smart to be able to carry those new habits and new ideals forward. Absolutely.
Dr. Jon Baugh, thank you very, very much. I appreciate it. You're always a very calming presence. A lot of these doctors are. They're so calm throughout all of this. Senator Kevin Cramer joins us right now, Republican of North Dakota. Senator, thank you for taking the time. The president is going to